Hello, everyone. We're just going to give a few minutes for all the attendees to filter in. Start in like 1 or 2 minutes. Okay, let's get started. Hello, everyone, and welcome to the second virtual town hall event. I'm Omar Fahmy, and I have the privilege of moderating this webinar. I'm a first-year student at the University of Michigan, and I'm involved with both the UNICEF Unite Detroit team and the National Arab American Medical Association, NAMA, Next Gen at U of M. We have a great lineup of panelists, all of which are accomplished physicians and evolved in academia. So they'll start us off with some introductory remarks. We will go into the pre-submitted questions that the audience provide, that you guys provided in your registration. We'll open up the floor for some additional questions. And finally, we will have some closing remarks. Before we get into the programming, I'm just going to go through some housekeeping notes. So some basic webinar rules. We have a zero tolerance for bullying, vulgar, or discriminatory language, including on the chat. UNICEF USA staff will flag and remove participants who use inappropriate language or display inappropriate names. We advise participants not to share private information on the chat as it is accessible to all participants. The chat is meant for participants to connect with each other and share best practices. While UNICEF USA staff monitor the chat and share limited content, questions should be directed through the Q&A functionality. And what is shared in the chat by non-USA staff members and non-NAMA members does not reflect the opinion or beliefs of either respective organization. If we go to the next slide. So this is the great team that put together this event, so kind of back end behind the scenes. As mentioned earlier, we do have a Q&A functionality, and so members of this team will get the questions to me to get to the panelists. So if you do see one of these names responding, they will have like a little panelist bracket around their name as well. So just to clear that up, I know that was a point of contention in the last event. So I think that covers all the housekeeping notes. Without further ado, I would like to introduce our amazing NAMA and NAMA supporting physicians. So first, we have Dr. George Kikano, who is the Dean of Central Michigan University Medical School. He is also a professor of family medicine. Next, we have Dr. Elizabeth Heath. She is a professor of oncology at Wayne State University and the Associate Center Director of Translational Science at Karmanos Cancer Institute and Wayne State University. Finally, we have Dr. Nidal Muqaddam, who is an assistant professor of psychiatry and behavioral science at Baylor College of Medicine. Thank you all for joining us. So we'll have a few introductory remarks by our panelists in the order of Dr. Kikano, Dr. Heath, and Dr. Muqaddam, and then we will start addressing the pre-submitted questions. So Dr. Kikano, if you could please start us off.
Thank you, Omar, and thank you, Leslie, for facilitating, and UNICEF for facilitating this forum. This is not a lecture, no PowerPoints provided. We're just here to address any questions. Our world, I mean, collectively has changed, I mean, just in the past 2 months. We've had technology, I mean, in higher ed, we have it in the clinics, we've had it for years. We never figured out how to use it. Then when the crisis hits, we're doing telemedicine, telecounseling, telepsychiatry, tele-education, tele rounds in the hospital. So our world become virtual. I think this is going to be, we're going to see lots of permanent changes. We're never going to go back to the classrooms to think. Education, healthcare had changed. It's changed already. It's going to change forever. How it's going to settle, what's going to look like, who knows? But we're starting to get some ideas what needs to be done to prepare us to the new normal. I know it's a cliche, but we're going to have a new normal. So looking forward to answering your question to the extent we can.
Hi, everybody. It's such an honor to be here, Omar, Leslie, and both organizations. You guys are already showing your leadership mettle just by having this and understanding that this is a big time of change. I think the many questions on all your minds is, what do we do next? How do we not just cope for today, but how do we plan for the future, when perhaps the adults and those leaders in charge may not already know what that looks like, and that's an even scarier discussion. So I'm really hoping that we can not just talk about it, but we can learn from one another about how to move forward. So thank you for having me today, and I'm looking forward to being part of this discussion.
Hi, Omar and Leslie and UNICEF and Nama, thank you so much for having me. I am very excited about this seminar and answering questions from our youth. In a way, I think youth are in a very difficult position because of the decisions adults have made and because of COVID-19. And so I'm really excited to have this conversation, and thank you.
Okay, great. Thank you all for your remarks. So the questions are going to be broken down into 3 different categories. These are the pre-submitted questions by registrants. We have a student-focused category. We have a category discussing family, friends, and schoolmates. And finally, we're going to have a category discussing the university setting and general education outlook. So my first line of questioning is going to be directed towards Dr. Muqaddam. So we know that COVID-19 and the circumstances around the pandemic have impacted students, in various different ways. In your experience, from a psychological standpoint, what are the most commonalities found, and what are suggested coping techniques?
So it has affected everybody, but especially students and young adults, because the normalcy is gone. Classes are suspended. If you have a job on top of your classes, that's gone too. You might be stuck at home even though you have not lived at home for a while, so you're back under your parents' roof. It's very tricky. The psychological effects have ranged from being bored to being upset to being full out depressed, but we're also seeing stress symptoms. We're seeing a lot of sleep disturbances. We're seeing a lot of disturbances in people's life rhythms. So, their sleep is not organized anymore, and because they've lost the structure, they are not eating on time, they're not sleeping on time, and that's been very bad. In some cases, we've seen cases of obviously of using more substances, more alcohol, more marijuana. It runs the gamut, but this is certainly stressful enough that it could trigger serious mental illness. So the majority of us are going to be just fine, but in some small percentage, we could have meaningful changes that we need to have addressed. Now, your next question was about coping. I think the first step is to acknowledge that this is impacting us. And the second is to try to maintain a structure. It's not going to be your old structure, because obviously the old structure is gone, but you need a structure and a certain routine to hold on to, because without that, we will all be very, very stressed.
Thank you, Dr. Muqaddam. And as a follow-up to these, I guess, coping techniques, including routine, I guess two questions. The first is, how can coping strategies such as a routine, how can that be addressed with family and friends? How can they be involved in our own coping techniques? How can we suggest, that someone needs to acknowledge that there might be a difference in their own life, and how they've been impacted by COVID-19?
So this is an excellent question. You know, some of us are really good about getting up in the morning, showering, dressing up, and doing what it takes to get going. And some of us are not as self-disciplined. And if given the chance, we'll just be in our PJs for 5 days. And you want middle grounds, right? So I wish I were one of those people who would work out every day regardless, but I'm not. And I look to my family members who do as inspiration. So that's the first way to reach out. You could be the role model and the inspiration. The second is to have activities as a group, as a family, because your family is part of your germ pool. You share the same bacteria, you share the same viruses, so you don't have to social distance from the people you live with. And therefore you could actually spend time with them and do stuff together. What I hear from the parent side is, oh, the kids are in their room all the time and they really don't want to talk to us. And some of the parents have said, well, do you think the kids even know what's going on? And the answer is yes, everybody knows what's going on because you guys are on your tablets and phones all the time. But I think the follow-up conversation is not happening. So as part of coping, I would really suggest a lot of conversations with those around you. So structured conversations and having a new routine that includes everybody to the extent possible.
Thank you for the summary at the end of the question. You mentioned earlier that some individuals might be afflicted with depression or anxiety. At what point should those individuals seek out healthcare or treatment? And especially within the Arab community, such treatment is stigmatized. So could you please explain to us how that looks like?
Good question. So everybody should seek some sort of help, but help is not going to the counselor or the psychiatrist necessarily. There are other levels of help that come before. Reaching out to people you trust is help. Reaching out to your mentors is help. Reaching out to spiritual care is help. So it is not just going to the counselor. If you go to the counselor, that is fantastic because it is a neutral third party who can listen to what's going on. I would reserve going to the psychiatrist for symptoms that are actually debilitating. So I would say think of care as a gradient, think of seeking help as a gradient, try to talk to more than one person about what's going on, get some feedback. And if you feel that what's going on is above and beyond just COVID-19, then my first step would be to seek some mental health assistance. Now, yes, there's stigma in the Arab community, but people are eager to talk. I think the main step here is to bring the ability to talk to people rather than putting obstacles. So I have yet to meet somebody who will not, within 30 seconds, tell me about how stressed out they are. So I think the stigma is mostly how do I access the care? How do I get the care? But once you get somebody in a room with a person who's willing to listen, it's not that big of an issue. And remember, we live in an age where everything is online. You could access support online. You can have a support group online. So it does not have to be, I have to make an appointment and drive for 50 minutes and be in an ugly waiting room that makes me think I'm dysfunctional.
Thank you for your insight and for sharing that. Dr. Kikano, this next question is directed to you. So given what's known and what's unknown about the circumstances around COVID-19, what are going to be the expectations in terms of learning and student performance? How are we expected to function as students both in the near term and in the medium term?
Actually, to be honest, I worry less about the students. You guys, your siblings, and people are listening to this webinar. You grew up with iPhones, with digital technology. You have friends using different gaming platforms, so you're familiar with technology. The issue is going to be more the senior, more middle-aged, older, who mean teachers, physicians, undergrad and grad, who's going to be less adaptive and less agile with using technology. So, there's definitely room for teaching online, but teaching online does not mean it can be an inverted classroom or just giving your PowerPoint presentation and asking a question. There's a whole new set of pedagogy that needs to be learned. This is happening on the undergrad and the basic science functions. We have, I am at the medical school. Our first 2 years, it was so easy. The question, how do you teach clinical skills? How do you teach anatomy? What do you do with dissections? Or do you get rid of anatomy altogether? The more challenging issues are things that needs face-to-face interactions with patients, with people. So we're doing, some of our affiliated hospitals, we were able to provide with consent from patients, video links to the operating room, video links to patients, to the patient's room and to the emergency room, but this is different than touching a patient, feeding a patient. Last week, one of our grand round speakers was how to do a physical exam using telehealth. There's so much you can do for telehealth. Check someone's eyes, body language, have them use a home-based pulse ox or a blood pressure. These are easy, but there are certain things they're going to miss on the exam. So, for the most part, we need to be adaptive, but there are some challenges that we're not there yet and things to be known. Question came out yesterday. I'm managing lots of issues around C19 with the undergraduate. We're asking everyone when they come back to campus to wear face masks. Somebody on my team yesterday said we have 38 students in this college. They are deaf. How are we going to teach them with your teacher, with the instructors wearing face masks? So do you go with plexiglass shields? Do you go for face masks? How do you accommodate patients who have challenges? All this is unknown, and there's no playbook for this. We're developing the instruction, the tools as we go.
Thank you for your insight. Wow, it's really incredible. Dr. Heath, so Dr. Kikano mentioned the differences between, I guess, more of the older graduate students and the undergraduate students. In general, though, the concept of being an engaged student has always been valued, whether that is being involved in extracurriculars, proactive in your learning. However, engagement might not be the same moving forward. So in your mind, what are suggested alternatives?
Yeah, that's a great question, and I really appreciate, both of my co-panelists' sort of insight on this issue. Let me just say that the first thing is, I think, to acknowledge that there's a sense of loss, not so much for the normalcy, but the loss that this is what you should be doing. Many of you on the call know I have a senior in high school, who's losing all sorts of things, proms, graduations, and I think it's important to acknowledge that there is that loss, and there's probably sort of no real makeup to that. But without us sort of acknowledging that there's this, like we said, a sense of a different normalcy, then comes the opportunity for innovation. And that's why I'm just thrilled to have all of you guys on this webinar, and to have this webinar recorded for others to also share in the messaging that every time there's a change in life, whatever that may be, it presents an opportunity for anyone, but mostly for the young people, because you guys always see life with a different lens. And the way one defines engagement, I think, can be defined by you as a group of people. Because there is no real norm at this point, there is no standard, tick box to check on your applications wherever you're going next. It presents an opportunity of how you think engagement is. It's really how one moves forward as a community of people. And I don't think those standards have changed any. The overarching standards of how we think in an academic university or in a workplace, but mostly in an academic university, are sort of measured by 3 ways. The first one is scholarship. So as we've heard earlier, it's important to have that sense of organization, that you're still paying attention to what is expected. So although online learning has sort of really been, disruptive for many K-12 or undergrad students, you guys all quickly adapted. I think it was really, the faculty that struggled with, how do I really do this lecture, and how do I grade you guys, and so on and so on. But you adapted and you moved on. But I think the opportunity comes with service and teaching, which is the other 2 big pillars that we think about when you're sort of moving in this space. So, from a service standpoint, the traditional ways one thinks about things is gone. You know, you're not going somewhere to help out. There's rules that differ depending on what county, what state you live in. And I think if you can get creative about understanding the community that you're in and look outside of your room, bedroom, apartment, and find out what those opportunities are, there's always people in need. So however you want to think about giving back in service, you define that level of engagement. If you can't show up to the hospital to volunteer, I'm sure there are other ways if you called up that they need help. So ask them. You don't need to reinvent the wheel. There's lots of people who need help. I think when you look at teaching as a pillar, you guys in some ways have already engaged in that with this webinar, because you're teaching others that this is one community that can come together, two organizations that can really share ideas. I think it's an opportunity to think how we educate each other during this really, crazy, unprecedented times, and figure out a way to be flexible and innovative as you move forward. Because guess what? If we were having this webinar maybe 4 or 6 months from now, the landscape might look really different. So if you're not nimble now, you will fail to adapt again. But I think the opportunities are all there to sort of reinvent what the markers really are. Because if Dean Kakano were to look at your application, let's say for medical school, I think he would be really thrilled if there was some real, new creative ideas on how you're helping your community and your teammates and everybody around you, and what those measurements are. So it's a time to be innovative.
Thank you, Dr. Heath. Your comments on opportunity and adaptability really give a lot to think about. We're going to be moving on to the next category now. And for our audience, please remember to use our Q&A functionality if any questions do come up throughout the webinar, and those will be addressed in the next section. So in terms of family, friends, and schoolmates, my first question is going to be again addressed to Dr. Muqaddam. The dynamics of the relationship between students, family, friends, and schoolmates is likely going to be changed. So what do you expect in terms of psychological impact? What are we going to need to learn as students to be able to adjust for this?
I want to pick up on what Dr. Elizabeth said about loss. There are losses that have been short-term and immediate, and there might be a longer-term loss. And so in terms of relationships, we've lost the community in the way it was, and we've lost the medical experiences, and we've lost the social experiences the way they were. Right now, everyone is scrambling, and we're trying to go back to some sort of functionality. And we don't even know if this functionality is staying with us long-term or not. And so the answer to your question is we have to right now just live in this short term, medium term kind of adaptability until we get a new longer term that may or may not stay with us. I don't think we can tell. I think that when you go to college, you're getting a lot more than just the learning. When you go to medical school and when you practice medicine, you're also getting a lot more than just that interaction. You're getting the environment that comes with it. My main concern with switching everything to technology is that the spontaneity is gone. On college campus, you can run into people. You can meet somebody by accident. Something could happen that changes your entire day. This will not necessarily happen when you're in your home on Zoom. So my recommendation would be for the next few months, try to keep as many of your relationships alive as possible, and then reassess in a few months, and let's see what we can rebuild and save.
Okay, thank you for your words of advice, Dr. Muqaddam. I'm definitely seeing a theme of adaptability here.
Well, it's also a theme of accepting loss, sorry. It's the loss. I think you have to remember that we're all kind of angry that this happened, but we're also all kind of having to scramble to deal with it. And this talk is not about medicine, definitely, but what Dr. Kikano said is so important. We cannot really practice medicine via a screen. We're practicing a semblance of medicine. You're building a semblance of an online presence socially. Is this going to be it? Will it substitute the real thing? I don't know. And honestly, what happens today, the effects of which will not be understood until 10 or 15 years from now. So adaptability is important because right now we just have to survive.
So you would say adaptability and kind of this acceptance of the loss as well, correct?
Yep.
Thank you. Dr. Kikano, right now we're facing a new set of circumstances, and you did briefly touch upon this in the prior question, but with limited access to teachers, with friends, how do you think this collaboration on schoolwork is going to shape up?
Talking at the professional or undergraduate?
I mean, if you could touch upon both, whatever you think is going to be more relevant.
So funny, what we're seeing on the college halls, I mean, some students decided, you know what, give me what I can online. I'm going to sit with family, friends, loved one, never want to come to campus. Before the C-19, we were seeing at least 35 to 45% of our students living on campus, taking most of their classes online. So what they needed the family, they need the campus experience. They need live to a dorm, they need to party, they want to work on the residence hall, but they do not want to attend classes. As we bring people back to campus, or we plan to bring them in the fall on the undergrad and the graduate non-professional, what we're hearing from people, with a few exceptions, we want back to campus, but we want to have a choice of our roommates. So we have some suites on campus that accommodate 4 students. We're planning to get them to 2 students. We're getting feedback, no, I want to go back with my roommates for 4. So students undergrad are looking for that social life, but they're okay with the instruction. They want the campus life too, but they're okay with the instruction being online, or have the flexibility to either attend online when they want to, or attend live when they want to. So students looking for that campus experience, they said we own it. We're not here to get a degree. We want that experience, which is very interesting. On the professional side, things going to look differently. So we do small groups for medical schools. We do small groups for PA program, nurse practitioner, PAs, and others. The question now, there's value in education to rotate the groups. So our groups of 8 per student, 8 per group, or 8 or 9, we usually rotate them so nobody gets too cozy with their friends. Nobody bullies them. So we rotate the groups every 6 weeks on purpose. What they're asking now is, I'm concerned getting new groups every 6 weeks. Can I stay within my bubble? So, they want to have the same group stability. So they want the experience, they want it limited, and they want to have a social life, but limit how many people they interact with. The big question was going to happen in hospitals. We're seeing hospitals now limiting guests, limiting family members when someone has surgery or someone is very sick. But the big question, how can you learn? Clinical medicine, it's easy. The science of medicine, from my perspective, I know Dr. Heath and Dr. Mukaddam will agree with me. The science is the easy part. The arts piece is more difficult, and the arts piece requires face-to-face interaction. I'm seeing you. The issue if I'm seeing you, Omar, I need to find out, what's happening in your family, in your context, and I'll be missing this just on a screen. So the screen is good. It's convenient for elderly, urban, rural. Saving time for workers, but it's not going to be enough for us to provide quality medicine. And how do you teach that is going to be a challenge.
Okay. Thank you for your insight, Dr. Kikano, and for highlighting both on the student side and the professional side. Dr. Heath, as a follow-up to this question on more of, I guess, the undergraduate level, the educational environment is changing, both at home and school, as we're seeing with this online learning and potentially hybridized learning in the fall. In your opinion, how should a student restructure their day-to-day life to be able to excel in school? How do you think we can make it a productive day?
That's a great question. And I think every sort of educator is struggling with that, because everyone's family situation and living situation is very different. In some sense, this epidemic and pandemic has heightened our awareness of the disparity that exists in communities, in organizations, and everything else. So some people have the luxury to be able to have their own room and maybe control that schedule. And some other people may have to share their rooms with other siblings and other family members. Maybe you're a multi-generational household. Maybe you have a single parent. Whatever it is, I think it's defining what success would look like for you, and being able to articulate and communicate that for when you move on. So as undergrads, you're struggling to find your own identity anyways. You're trying to break away. I have an undergrad at home who just finished sophomore year, is a rising, junior? How do you gain independence when you're still in your childhood bedroom, going on Zoom calls with your professors who are struggling to figure out how to work their PowerPoint? So it is a weird new normal, but I think you have to account for your day-to-day the best you can, as long as you can spit out the metric. Now, I think that medicine and science, we're a very metric-based organization. It's diverted to everything related to quality and how do you justify efficiency, but from a human level interaction, it's really how do you account for your time as a human? And maybe your definition of success is not being on the online computer because your family only has basic level Wi-Fi, but you're there taking care of your grandmother all day, and you just need to explain that. So when you are applying or going on to whatever is your next destination, you can account for your time. I think we have shown that even pre-COVID, that accounting for your time is a very important measure. When we see on people's resumes, why is there a gap of time that you can't explain? It's because we're highly curious for very productive people. What happened? What did you need to take a break? Are you just bad at organizing your resume? So I think that level of organization is really it will work well for you as a human once you figure out what's important to you and how your day-to-day structure works. Some people pre-COVID and maybe even during COVID, have jobs. So there are a lot of folks that are undergraduates that are paying their way to school, and they're accounting for their time by maintaining their jobs, but perhaps a lot of their online schoolwork is suffering a bit, but you just need to explain that. So I think there's a sense of, maybe dread that perhaps your next destination, people won't be understanding. Where I think where we can improve upon that and maybe minimize the dread, it's by recognizing how you contribute to your family, your circle, whether it's your local circle, your community circle, your national, and so on. So in that sense, the diversity is quite great. So it may be that you take care of a loved one. Maybe you're a hyper academician and you're online 12 hours a day, scouring things. Heck, maybe you guys are writing a book. Who knows, right? So however that is, you just need to define it and explain it.
Thank you, Dr. Heath. At least to me, I think that is a pretty reassuring notion, having, being able to explain like what we're doing and why we're doing it. And so now we're going to move on to the next category of questions, which is going to be university setting and general education outlook. So Dr. Muqaddam, the phrase new normal was referenced by Dr. Heath just now, but in this new normal, what resources are going to be needed by the university or by student organizations to help lessen the psychological impact brought upon by this pandemic? So if you could also address concerns over social isolation, home life, depression, anxiety, xenophobia, whatever you think is best appropriate.
Thank you. A good question. So you want to start with the smallest building blocks possible. The smallest building block possible is my class or other obligations I have. If a class turns to online, that does not mean that it is going to be some opportunity to multitask. I think this is something we've all established. If I try to multitask during use of technology, the benefit I'm going to get out of using the technology goes down. The class won't be as useful. Usually there is a distance and a physical separator between tasks for every person. So if I'm going from one office to the next, from one clinic to the next, from one patient to the next, there is that buffer that allows me to refocus. And so as people go back on campus, we need to make sure that the buffers are still there, that there is a crisp separation between activity A and activity B. When you do get organizations and societies back, which I really hope happens soon, what you want is hopefully for these gatherings to remove obstacles that would be access obstacles to get help. I don't need to go make a formal 45-minute appointment to get counseling. I would like to get counseling from everybody I meet and make the 45-minute appointment kind of icing on the cake. Of course, if you need the counseling appointment, by all means, but it shouldn't be the only source of counseling. So I would say that organizations have a huge impact on student life, because if you remove those barriers to entry to treatment, then you can bring it closer to everybody. And that way you don't have to wait until somebody gets really sick to get care. Why am I saying that? I'm saying that because college by itself is a very tricky phase. This is when a lot of serious mental disorders start. You might have a new onset bipolar disorder. You might have new onset psychotic disorders, schizophrenia. Casual drug use might turn into an addiction. And so we have to be very mindful to catch these before they ruin somebody's life. But for everybody else, who's a little anxious, a little depressed, a little worried about, should I wear a mask? My mom's calling me 5 times a day. What do I do about this? They should be able, hopefully, to get care everywhere. They should be able to get support everywhere. So my main advice here would be talk about it. Make sure the barriers to access are removed. You said something about xenophobia that was very interesting. It's so important to address that. And again, the first step would be to talk about it. Talk about it and educate yourself. And you and your group are amazing. You're already doing what it takes to change what's going on around you. But I fear that sometimes people don't get adequate information. They get information via celebrities. They go on YouTube sometimes, but they are not getting scientific information. So they don't really know what's going on. So the fear stays there. And I think everybody knows, or it makes sense to everybody, that when I don't know enough, then my judgment will be taken over by more of an impulsive decision-making path. So if I see you and you're tall and scary, then I might run away. But if I knew you and somebody said, oh, this is Omar, he's nice, then I might take the time to get to know you better. And so diversity and exposure, as well as appropriate information, would go a long way in helping with the xenophobia. Again, that's something for societies and organizations to do.
Well, thank you for your comments and for joining us here, educating us all. Do you think that universities, as they are now, are they equipped to follow through on these suggestions that you think should be implemented? Like, is there a standard for this in universities, or is it something that we're going to have to adapt and implement as student organizations, something that we're going to have to make sure that universities are implementing?
Most university health centers have a very nice complement of healthcare professionals who are there to take care of people. And they usually do a fantastic job, and they're usually very careful in their assessments and very thoughtful in the plans that they offer. It's a tricky job because you're a young adult, your parents cannot be fully involved in your care since you have your rights to privacy and confidentiality, but at the same time, you might not really know what's going on. And so again, this runs the gamut from simple anxiety, simple depression, where you're adjusting a little bit to what's going on. And that hits about 50 to 55% of freshmen anyway. So in the era of COVID-19, it might be higher, which is a scary thought. So yes, healthcare in universities is usually solid. Very nice people, very thoughtful. What I'm worried about though, is I am worried about the volume. I'm worried that if 10 times more people need to talk to someone, the process will not work as smoothly. And so some of what the universities will have to do is get this closer to the students and make it part of the social fabric and the everyday life if possible.
Okay, thank you for the reassurance and for the additional elaboration. Dr. Kikano, back to you. We've already spoken upon this topic about how university life might be shaping up in the near future. So going past that, what do you think the long-term ramifications are going to be of the circumstances we're in now? So in short, how do you think the future of university life and education will look like, both in the near future and extending a bit past that?
There's so much we do not know about the virus at this point. So we're starting to understand it better. I mean, things are changing on a weekly basis. We don't know how virulent this virus is going to be, how much more how much more spread's going to happen, whether we're going to have a vaccine, medication for the virus within a year or 2 years or 3 years. It really sorry, it really depends what's going to happen with the virus. Having said that, there are social norms, I mean, professional, personal things that have changed that would not come back. You're going to see plexiglass at cashiers. You're going to see less people, I mean, in the Middle East, hopefully, and I mean, here, less people hugging and shaking hands. So people going to mean airline industry, restaurants, I mean, how do you, salad bar, I mean, we just had a meet with our vendor, I mean, with our vendor for food services on campus. They said no more self-serving, no more soda fountains, and no more salad bars. So small things are being discussed now. These things are going to go away. The analogy I used before 9/11, you have a guest from the Middle East, I used to get them to the plane. I mean, you walk to them, walk to the plane, I put my mom's seat belt, and she's back to the Middle East, no issues. 9/11 came, none of us got on a plane for 6 months. Now, I mean, never in my lifetime going to go inside the plane unless I'm a passenger. So you have TSA. TSA is going to be checking temperatures. So these things, I mean, as they change, some of them is going to be permanent, and some of them are going to evolve, depends what happened with the virus. I am personally optimistic. We're going to find the vaccine. We're going to find it soon, and that's what people are, what people are talking about. But once that happens, things have changed. Some of them are permanent, and we're going to be, with resilience, we're going to adapt, and the world will go on.
Thank you for your insight, Dr. Kikano. Dr. Heath, to wrap up our pre-selected questions, in this new normal and university environment, as an educator, what should students consider doing to distinguish themselves? If you could please touch upon that.
You gave me the hardest question, Omar. It's the hardest because really nobody knows. Nobody knows because, again, the rules are changing is what you're hearing, and I think you're hearing that from everybody. But one of the things that you guys can think about is what's important to you. So as a generation, I think, yours or whatever next generation is coming after you, you get to define who you are as a body of people. And everybody sort of has that, per generation. But you get to define really what is important to you. I think the basic principles of how we function as a community, they haven't changed. We still want to be respectful of one another. We want to be helpful. And those of us who are choosing their careers in healthcare and in medicine and in science tend to go a different way where we really want to help people. But the opportunities, if anything, have become more vast because you guys have to think more creatively. There are no set measures that X amount of kids have to go to research labs to go ahead and get on a paper to do a project. That's good. That's what it was pre-COVID. But we don't even let medical students on in the hospitals to do rotations, and they're supposed to be doing their 3rd and 4th year. So there already is a disruption. So for high schoolers and undergrads, that's a bigger challenge. And so maybe that's not the approach that you take. There's also a lot of folks who volunteer normally in the hospital or whether it's downtown at a university or local near you. Those are rules in place as well. We don't have volunteers in our hospital. Everyone is underaged and we're quite worried about everybody's safety. So timing wise, there might be an entire class or two where that has changed. So there's other ways to volunteer. You guys right now are setting up a new precedent where you're uniting 2 organizations that you're passionate about and sharing information. This is already an innovative way of how you're helping one another either spread, a certain set of knowledge or inspire each other. But you can get creative on how you want to present yourself to the next level in the sense of how did I deal with stuff that I wasn't expecting to happen? And guess what? Even pre-COVID, that was a legitimate question on an interview, right? Everybody is thinking I'm going to go on a certain path, but most people in medicine know that path is not straightforward. And most people have had to get very creative to get there. But if you have that determination and you have the grit to want to be somewhere, you will see it. You will figure out what to do. So my best advice is think again, very creatively. The need in our community, whatever community you belong to, is great. Maybe it's to help with mental health, to destigmatize that, because there is a stigma, whether it's culturally based or just, you know, your organization based, whatever. But the mental health aspect is lacking even pre-COVID. Now it's stressed to the max, you know, peri, and it will be post-COVID, and we hope there's a post. From a scholarship standpoint, you don't have to be in the lab to show academic potential or curiosity. So maybe you're doing literally a book. Maybe many of you are teaming up to write a review paper. Maybe you're doing some surveys like you're doing right now on this webinar, and go write it up. That is an academic exercise to show that you're still thinking creatively outside the box. I think there's also opportunities in your community. Go call your local food shelter. Go call your local homeless shelter who's in need prior to COVID and now are stressed to the max and don't know what to do. And maybe it's you showing up with a mask if allowed, and if your parents allow it, to go and contribute to do something on a global level where they need more hand sanitizers or masks or whatever. But you guys get to define what that looks like. At the end of the day, whether you're contributing to your community, to your family, to whatever, when you apply to the next level, let's say it's medical school, you just have to explain, and you don't need explanation, because I'm sure the prompt will say, in the COVID world that you're in, what have you done to either rise above it or to contribute? Because if you take out COVID, it could be any instance in life. And we just want to show and see that you, as young people, are resilient, motivated, engaged, and caring to those around you. And those parameters or those characteristics of who we want in our community of, let's say, physicians and scientists, they haven't changed. You just have to show it differently. And I'm hoping that that gets a lot of you on this webinar's creative juices going. You know, think outside the box. We're actually asking you to do that, not just to say, this is what we want. This is truly what we want. Maybe it's really to help your professors be able to do something other than stream on Blackboard and doing a really bad job of it. Maybe you got to teach us how to be better lecturers, or come up with some innovative idea of how to teach you and to keep you engaged for 45 minutes on Zoom.
Thank you, Dr. Heath, for your words of inspiration. Definitely a big takeaway for me is trying to find the needs in the community and figuring out creative ways to contribute to helping. I think this is going to be a good segue to our first anonymous question. I'm not exactly sure who to address this to, but from Anonymous, how should students manage the guilt they feel when they aren't being productive, despite having so much time given quarantine? What are some mechanisms to help bring balance into our lives when the days blur together and our environments don't change?
I think I'll take that one. If you Google not productive during quarantine right now, you are going to get so many articles. There's a sense of guilt that this is almost like a vacation. I should be productive. That's not true. This is not a vacation. This is extremely stressful for all of us. And COVID has kind of created two parallel universes. One universe where people are stuck home and they don't know what to do with themselves, and the other where people are super busy and have extra work. Like, I know I've been very busy. I'm sure you two have been. It's unpleasant. It's very busy. And we have not been able to get a grip on it. So some of us just bury our head in the sand and work too much and try to just navigate it. But if you're at home and you feel that your sleep is not okay, if you feel worried, if you turn on the news and you get panicky and anxious afterwards, that's perfectly okay. It is a perfectly rational response to what's going on, because this is A, unprecedented. This is B, of a scale that we have not seen in forever. This is really, really big. It's not like you can decide, oh, I'm going to go to a different country and live normally. Not a single country has been unaffected. And so I think people need to be kind to themselves. Your first step is be kind to yourself. Once you get your bearings again, then you can start going back to life as it is normal for you and try to be a high achiever. In the beginning, it's okay if it hits you like a big blow, because it is a big blow. So acceptance, please.
Thank you, Dr. Muqaddam. So I have two questions which I think address a similar topic. So from Hassan Fahmi, Dr. Kikano, how are you evaluating students' performance and learning? The traditional model of exams and testing is not applicable. What other paradigms are being discussed? And a very similar question from Tariq and Joseph, from Tariq Hanna and Joseph Snej. How do you expect medical schools / residency applications to adapt to the pandemic due to online learning? How will GPAs and matriculants shift? So I guess discussing what other paradigms are being discussed in terms of evaluating student performance.
Sorry, I was muted. If you have medical students in the audience or who are asking, assume these are coming from medical students. Unfortunately, I mean, exams have been delayed or canceled. I mean, there have been many issues with that as recent as last week. The company that administered the exams on behalf of NBME, ACGME, or AAMC, these are the more governing agencies for higher ed and medicine. A company called Prometrics, they did not have their act together. We had students that showed up for exams to take their step one. After getting a confirmation 2 or 3 days before, they showed up at the Prometrics test site and things have been canceled. So for students, for one, the MCAT has been shortened from 7.5 hours to 5 hours, which is great for students. There are going to be more additional days opening up for MCAT starting in end of June. And they're going to have 3 MCAT sessions per day on these dates. So there's going to be more availability for that. On the step one, most medical schools have waived the requirement for step one to advance to your second or third years. If you have not taken your step one, you still can advance irrespective of where your medical school is. There's been consensus about medical schools to do so. Clinical skills have been, step one in a year and a half is going to be pass and fail. We try to push in the organizing body, NBME, to make it pass and fail this year as opposed to have numerical grade. We've had no traction, unfortunately. So the step one is still going to be numerical grade for this year. 2021 is going to be pass and fail. We're hoping that the step two will become pass and fail too. The issue now is going to be clinical skills, where you have to travel to a certain site, interact with standardized patients. There are no provisions at this point to administer the CS any differently. Again, residency program, if you are a 3rd or 4th year applying for residency program, the deadline has been pushed by 6 weeks. Most interviews are going to be virtual. We're going to be reviewing applicants for medical school without an MCAT score based on a holistic admission process. We'll deal with the MCAT when it comes to. It also depends on some schools. I mean, big schools insist of having an MCAT, which is going to disadvantage some students. Community-based schools are more flexible.
Thank you for providing us with a better clarity of what to expect, Dr. Kikano. This is from Anonymous. How would you suggest college students who are used to living on campus maintain a healthy relationship with their family when they feel that their independence is being compromised? So whoever best feels they can cover the question.
There's psychiatrists in the room.
The psychiatrist in the room. Okay. I'm going to go back to the theme of loss. This is a loss. This is a shock for everybody. There has been this joke around saying that the suicide rate is going to go up, but also the divorce rate. And everybody's saying, I can't stand being with my spouse, my parents are obnoxious, etc. So it's going to take a great deal of adjustment and adaptability. My positive side would like to take this as a great opportunity to show my parents that I've changed, and that I have become a young adult with my own preferences and my own personality. Some of that comes from them, some of that comes from what they've taught me, some of that comes from what they have not taught me, some things that I really don't like about them and I've tried very hard to change, some patterns I've grown up with that I really, really think are not the healthiest. And so this might be a beautiful chance to have a new equilibrium in a home. Now, mind you, that being said, everybody is stressed out, so the new equilibrium will not come without some arguments and skirmishes, but it is definitely time for a new equilibrium. And this doesn't just apply to young adults going back to their parents' home, it applies to couples, it applies to multi-generational families. And I want to throw this in there so you can think about it. This COVID-19 business is bringing up disparities in a way that's really flagrant and very sad. It's bringing up disparities in socioeconomic status because we can turn everything technical. If you don't have internet access, you will not be able to partake. We can offer you the best online course possible. If you live in a 2-bedroom apartment with 4 other people, you are not going to be able to create the space to be able to attend. I could offer you the best curriculum for wellness available out there. But if you are a caretaker and you have extra responsibilities and you're one of those college students who has 10 other things to do, you're not going to be able to do it easily. So the stressors are not going away. So I would say, in summary, the negative aspect of this is you have to be adaptable and you'd have to remember it's a short-lived phase, hopefully, but it's an opportunity to find a new equilibrium and show your parents you are now an adult.
Thank you, Dr. Muqaddam. This is going to be our last fielded question, directed towards Dr. Heath. So as we know, learning does take place in the classroom, but it also takes place outside of the classroom, between classes and through other resources. With more remote learning, which is likely here to stay, this second part is going to be greatly impacted. So help us think through this, Dr. Heath. What will that impact be? And any ideas on how to adapt?
Omar, you keep giving me the hard questions. I tell you, I think this is where there's no right or wrong answer. As was just mentioned before, we used to have a place to decompress that has nothing to do with family or work or anything, but those places of joy, we'll call them, whether it's the gym or the restaurant you like to visit or the coffee shop, they're all off limits. I think there are creative ways to really think about how you could gather. You guys as in the young people, were already on social media way heavier than probably any parent would like to see. But I think that you can also leverage new technology to figure out how to hang out. So as I understand it, and I see now all over the place, you can make music while you're on Zoom. It doesn't all have to be business. You can get the 5 of you and play instruments. There are book clubs that are popping up all over the place, again, virtually, that is sort of a safe place that gives you a chance to decompress, that really has nothing to do with your day-to-day life. So I think what it does is push forward perhaps whatever discomfort you had in this area, where a lot of people who weren't social are now feeling like I can actually be more insular, which is hard because they need to push themselves. And then the very social people feel like I'm trapped at home and there's nowhere to go. But you need to have a fine line with what you're doing for your job and what you're doing for you as self-care and what you're doing for your family. And I think that can only happen if you communicate well with those around you. Your peers haven't gone away. And if anything, everyone is feeling the same level of misery and stress. So get yourselves together. Now, how one organizes that, I think sort of becomes an issue of what group you belong to pre-COVID. So you've got UNICEF on this call as well as NAMA. I'm sure there are other interesting, maybe you do a mashup of different organizations that can learn from one another. Maybe you take a music group and you put them with an athletic group. Whatever, mashups happen all the time. And maybe that's a way to get creative and strategize your energy. But as we workaholics on the three of us on the webinar can tell you that if you don't establish those lines, that when you go home, you take care of yourself and your family and those around you, the burnout is great, whether you're in COVID or not. So self-care for yourself as a young person and your family, if you see them stressed out, or your community, is so great that I think those are the opportunities that you can take to figure out how you can help. But find your other communities, and maybe it isn't on Zoom, but I know you guys use other social media platforms. Don't even think that I'll be on TikTok, but apparently that's a cool new way to communicate and show dance moves and whatever else. And maybe you put positive messages on TikTok. Maybe you have animal lovers out there that want to help make sure that those who have animals have a way to help each other throughout COVID. So I think the possibilities are endless, and I'm counting on you guys as the next generation to really establish what the new normal is.
Thank you, Dr. Heath, for tackling the tough questions and your words of encouragement. So as my last question that I present to you guys is, do you have any final words of advice for our audience? Is there anything that you wish you could have spoken upon that you haven't yet? Any final remarks? So if we could do that in the order of Dr. Kikano, Dr. Heath, and then Dr. Muqaddam. Dr. Kikano.
I know this, cliche world, unprecedented, new normal, of that stuff. We're gonna get over this. There's gonna be, it's gonna be a tough road there. There might be a second wave. These epidemics have happened in the past. We have more technology, more science, more awareness, more social media. Don't give up. Things are gonna get better. They're gonna be different, but we're gonna get over this. When? Who knows? I'm personally optimistic. This has disrupted the economy, disrupted our lives, but we're going to be resuming a new life, new way of living in the future. So please don't give up. Any of these students, do not give up. Do not give up on your education. There are some people out there questioning the value of education. Your best saving account in your life is getting good foundation. Get it when you're young. Get a degree, whatever career you go to. Do not give up on education, please. It's your best investment.
Thank you, Dr. Kikano. Dr. Heath?
I think the big word here is commitment. Many of you on this call are committed to pursue a career in healthcare and medicine and research. Don't give up just because there is a pandemic going on. There will be other things that happen in your life that will derail you. It's up to you to be resilient, again, innovative and flexible. That's what we look for, because stuff happens all the time in healthcare that derail you. You weren't expecting to do something. You had no idea there was going to be something that happened that you weren't prepared for. But that ability to bounce back and to stay whole in that process is key. You guys are getting just an early look at what that would look like, but here's your opportunity to make that happen. But it can happen if you stay committed. Staying committed is with a big C. Put it on your bulletin board, whatever it is. If you have that as your goal, you will succeed. I'm an oncologist by profession, so I always expect the worst and plan for the worst, but man, oh man, do I really pray and hope for the best. And with that kind of attitude, we will persevere. And Dr. Kikano has it right that you guys are not in this alone. No one is expecting you to do the impossible. We expect you to be the great young people that you are, and you will all be contributing members of society. So you will succeed, and we'll be here to watch you do it.
Oh, this inspired me. So I have 3 points to make in conclusion. Number one, this is very confusing for young adults who are seeking excellence, because all of a sudden the parameters by which excellence is measured has been taken away. So all these parameters like the MCATs, the steps, the competitiveness, they've all been removed, and it's hard to prove excellence that way. Feeling confused and discombobulated makes so much sense. Number two, social distancing is forcing many of us to reevaluate how much we need people. It's proof to us that we actually do need people, even if you thought you were an introvert. And so remember that just because we're distancing physically does not mean that we're gonna cut off ties. And so at this point, the most important is to keep engagement with others to the extent possible. And the third point is be kind to yourself, please. That's the most important thing you can do for you and for your families. Be kind to yourself. Don't be unrealistically expecting that you're gonna write an encyclopedia during 2 weeks when you are worried about whether you're sick or not. And thank you.
Thank you all for your comments. So as we wrap up this event, I would like to thank both NAMA NextGen and UNICEF Unite for providing a platform and working together to make this event possible. Leslie, if we could please transition to the slides. So I would like to plug, in the theme of mental health, I would like to plug the Meditate for Medical Heroes, an event which is going on Monday regarding online yoga class of that sort, which is going to be hosted by NAMA NextGen at Oakland University. If you are interested in joining UNICEF Unite in the fight to help UNICEF reach the world's most vulnerable children, please check out this GoFundMe. Everything is going to be COVID relief related. So that's also going to be plugged in the chat. Please check that out. If you're interested in being proactive and contacting your legislators in regards to COVID relief, please text coronavirus to 52886. That's also going to be put in the chat if you want to check that out more. And finally, thank you all to the audience for joining us. And on the behalf of NAMA NextGen, UNICEF Unite Detroit, thank you to the panelists, to Dr. Heath, to Dr. Kikana, to Dr. Muqaddam, for taking time out of your busy lives to educate us. You truly inspire all of us with your service to society. Thank you.
Thank you for joining. Thank you, Amar, for organizing.
Thank you. Good luck, everybody.
Thank you very much for having us. This was really, really nice to participate in.